Hello everyone, my name is Sabine. I'm the Community Engagement Officer at Timberland District Healthcare Service. Welcome to our March vlog in which we highlight some of the awarenesses during this month. Later in this section I'm being joined by Amanda who will talk about some of the health events this month. But firstly I'm joined by Rebecca McAuliffe. Welcome Beck.
Thanks Sabine.
Who will assist me in highlighting some of the events during this month. So a lot of us would know you, Beck, but just for those who don't in the community, can you tell us a little bit about yourself and what you do at TDHS?
Sure, Sabine, thank you. For those who don't know me, I grew up in this area. I was actually born here at the Timberland Hospital. Went to school here at Timberland as well, and most of my family still reside here. And I've been working at Timberland District Healthcare Service as the Executive Assistant for 2.5 years now. So people may have seen me around, but yeah.
Yeah, that's great. It's always good for people to know where you fit in at the healthcare service.
Yeah.
It's Endometriosis Awareness Month as Endo March. You've had your personal struggles or journey with this disease. Can you tell us a little bit more about your personal journey with it?
Sure can. I'm very happy to share my story in the hope that it might help anyone else out there in the community. So for my personal journey, I suppose I was what I would consider a normal developer. I got my period when I was 13, I think, and everything was pretty standard and normal. Also, like many other people, I did go on the contraceptive pill, and that was to help with, at the time, with period pain. So I was on that for 16 years. And then when it came time for conceiving, I was married at the time, went off the pill, and that's when, I found I had a little bit of trouble conceiving and I was having quite severe pain with my periods.
Yeah, okay.
But I suppose at the time I just normalised that.
As we all do, as women.
Because I'd been on the pill for so long, I think I just forgot what it was like to have, a normal period. So fortunately for us at the time, I sought some help from a naturopath, and we did actually fall pregnant, with a little bit of intervention. But it was after we'd had Claire, so she was a normal pregnancy. Everything went great. Once Claire was about 18 months old, we wanted to try for a sibling. Yeah. I think that's when the endometriosis really took hold of me. I had no idea that such a thing existed. Yeah. So having a toddler, Tony and myself were running the hostel at Port Campbell at the time, and increasingly each month I was getting more and more pain, to the point where I was consistently in pain for most of the month, and I was on very high doses of pain relief, being on endone for majority of the time to just cover that pain. I suppose that's where it got to a point where I needed definite medical intervention. That is not normal. That's part of my message to the community, that that level of period pain is definitely not normal, but I'll talk a bit more about that after. So I suppose just getting to that point, I persevered with seeing the GPs. It was endometriosis on average takes, I think, about 6.5 years to diagnose. It's a really complicated disease, and it can manifest itself very differently in everyone. So for me, it implicated my bowel, which made it very difficult to diagnose because, of course, that was taking the focus.
That's exactly right. The doctor would think that it might be that. That's just one example for myself. So I finally got a referral to see Dr. Liz Uren in Warrnambool, and she performed a laparoscopy on me, and once she'd gone in, she came back out and said that was one of the worst cases she'd ever seen of endo. Wow. So all of my organs were gelled together. Yeah. So from that point, I was then, over a period of time, but ended up having quite significant surgery at the Royal Women's in Melbourne. Was looked after really well down there, and had a large section of bowel removed.
had a big section of endometriosis removed, and from that point on I've just been going up and up with my health. So I'm one of the lucky ones, because I know of a lot of people that aren't that fortunate. I've had one surgery and I've been pretty much pain-free since then.
Wow. And so with that in mind, and also I guess with the symptoms that could be indicating something else, what's your main message that you really want to get out there to women and men as well, I guess, in support of their partners?
That's a really important point, Sabine, that this is not, yes, while it is a disease that affects women, but of course it affects the men in their lives as well. So my message is to you to make sure, if you're suffering from what we classify as pain that interrupts your day-to-day life, we all know that a little bit of cramping at the start of our periods is okay if you're used to that for 1 or 2 days, but we're talking about a pain that interrupts your day-to-day life, where you can't function properly, and it's persistent over time. That persevere. Go back. If it's not the first doctor, go to another doctor. Just keep persevering until you get to a point where a diagnosis is made. It may not be that it's endometriosis, but it could be another one of the diseases that affect female fertility and things. So just persevere. Know that pain isn't normal, and it's a tricky one. It is. So just keep getting back to the doctor until you can get to a point where you're happy with the diagnosis and the treatment proposed.
Yeah, and I guess with all the more awareness that is out there, I mean, a lot more celebrities, and you do see a lot more of it out there, that people actually are openly talking about it, because it's not always a comfortable subject, but it needs to be spoken about to make people aware, and GPs and everyone else to that, and more research being done.
Yeah, absolutely. Yeah, you're spot on.
And with your, you're always so positive and, very resilient. With that in mind, that you've gone through all that, it's always good to, have a smile on your face and put a little bit of fun in the days as well. And you working here, you've definitely shown that with being the great force behind our Staff Fun Days, and the community has probably seen various Facebook posts with the lovely photos and the lots of fun, which you're the main force behind, which is very important, isn't it?
Oh, look, I think that's part of life. If you can have a positive attitude and enjoy yourself, have a laugh at yourself, and make other people laugh, that's gold. I think that's a really great mindset to be in. But by all means, I think I get the most laugh out of myself sometimes than what other people do. But it's great fun to be a bit lighthearted sometimes. Life's hard enough as it is. So the opportunities that we get to dress up as icebergs, or have crazy hair days, or whatever it might be, we have a great time on those days.
Yeah, very, very important. Very important. So thank you very much for sharing that very important message with the community and us. It's in the quarterly as well. So for the whole story, you can read our quarterly, which is out now. And other community stories in there as well. So thank you again, Beck.
Pleasure. Just quickly, if anyone would like to talk more about it, I'm always open. My door's open. So by all means, reach out if you need to have another ear of someone who's gone through something similar. I'm very happy to talk about it. So
that's great, because a lot of people don't really want to make that step straight to the doctor, and might want to find out a little bit more information of someone who's gone through it. So that's great. Thank you for that offer. And I now hand over to Amanda to highlight some of the other health awareness events in March. Over to you, Amanda.
Thanks, Sabine. So Hearing Awareness Week is the 1st to the 7th of March, something that is close to my heart, being hearing impaired. We do have Tim Rayner Audiology that comes out from Warrnambool once a month to monitor those with hearing impairment. We also have highlighted a family's incredible journey to enable their little girl to actually hear, something most of us take for granted. You can read Aria's story in our next quarterly. Every year, Celiac Awareness Week occurs the 13th to the 20th of March. It aims to raise awareness about Australia's relatively low diagnosis rate of this disease. An estimated 80% of people with celiac disease never knew that they had it. Yet early diagnosis reduces the risk of long-term consequences. TDHS is excited to introduce our new dietitian, Casey, starting on March the 1st. She'll be working 2 days a week, and for an appointment you can phone 555 86 000. The 18th of March is actually World Sleep Day. This day places a spotlight on highlighting the importance of adequate sleep and how it is an essential part of a healthy lifestyle. Quality sleep is vital for concentration, memory, learning, and it also improves our mood. Whereas lack of sleep has the adverse effect. It's found to impact negatively on both physical and our mental health. It also can be dangerous and lead to poor decision making. So why is getting enough sleep important? It lowers our risk of serious health problems, obesity, diabetes, heart disease, reduces the risk of illness, and it boosts our immune system. It also helps to regulate a healthy body weight. So I challenge you all to take the opportunity to review your bedrooms this weekend and your sleep patterns. Is it time that you got some good quality shut-eye? We have another first aid update planned for the 19th of March. We do this twice a year and we partner with Wadia. It'll be at the golf club between 9:30 and 12. So look out for the flyers around town or phone 55 647 401 to register. COVID booster vaccinations are now available at the Timboon Clinic for those in our community who have completed their initial 2 vaccinations 3 months ago. I am regularly asked by community members when or how long do I need to wait for my booster vaccination after I have had COVID-19, which is quite relevant for many in our community. The advice from the department is when you are symptom-free and you've completed your 7 days of isolation, you can actually access your booster. If you're due for your booster, don't delay. Make an appointment at the clinic today on 555 86 088. And a reminder annual flu vaccinations. We haven't had much flu infection over the past 2 years, probably because we haven't been moving around as much. We've been wearing masks, hand sanitizing, and even social distancing. But now that restrictions are easing, social distancing is almost not happening, there will be not so good flu season. We ordered our flu vaccine before Christmas, so keep a lookout for when that's available. Until next month, stay well and stay safe. Back to you, Sabine.
Thanks, Amanda, for highlighting these health awareness events in March. And thank you, our lovely community, for joining us again. We are slowly going onto the road of COVID normal. We're a very resilient community, as Beck has pointed out. We're very we have fun now. We put a smile on people's faces, and we are there to support one another, which is very important. So we've got a lovely community, and together we can get through this. So stay being mindful to yourself and others, and we continue to work together for a healthy community. Thanks, Beck.
Thanks.
Thank you.